Good morning, everyone. I'm going to call to order the Joint Subcommittee on Human Services. Welcome to everyone in attendance here in Carson City, also in Las Vegas, and anyone watching online on this very cold Carson City morning, if anyone is here. I got up and I was like 13 degrees is not my jam, but we are all here and it's nice and warm. If we can go ahead and Committee Secretary, if you could please call the roll.
Assemblymember Brown May. Assemblymember Dickman. Assemblymember Hafen. Assemblymember Hibbets. Assemblymember Howdigi. Assemblymember Monroe Moreno. Assemblymember Yeager. Senator Canizaro. Senator Dondero Loop. Senator Stone. Senator Titus. Assemblymember Mosca. Here. And Chair Wen.
Here. And if we can mark Assemblymember Hafen, Senator Canizaro, and Senator Titus present when they arrive, that would be greatly appreciated. Just the brief housekeeping rules. I know I don't probably have to tell it to anyone in this room, but I will just give a reminder. Silence your cell phones and electronic devices. Again, if you are testifying, and I will try to be better, and I don't want to have to cut anyone off, so if you can remember to state your name before you testify, and the first time that you get up to the table, if you could spell your name, first and last name for our committee staff, that would be generally appreciated. And I will do my best to make sure we do that. Today we have the Division of Child and Family Services, or DCFS. There are 7 total budgets on the agenda for today. The remaining DCFS budgets will be heard at a later date. And I believe that Administrator Marla McDade-Williams will be presenting on their behalf. So if you'd like to come to the table, state your name for the record. And I guess we will start with our presentation. If you could start with the budget account ending in 3146, the family support programs, I think that would probably be most beneficial. And then we'll probably have some questions for you as you go along.
Good morning, Madam Chair. For the record, Marla McDade-Williams. I serve as the administrator for the Division of Child and Family Services. And this morning I have with me Kelsey McCann-Navarro, who will actually go through and start the presentation, and then we'll be available for questions.
Good morning, Chair and members of the committee. My name is Kelsey McCann-Navarro, and I serve as the Administrative Services Officer for the division. Starting on slide 7. So the following slides provide an overview of DCFS's governor's recommended budget. So budget account 3146 is our family support program budget. The Division of Child and Family Services is responsible for the quality and oversight of programs and services in the child welfare, youth mental health, and juvenile justice systems. Within DCFS, the family support program and the planning and evaluation units both focus on quality and fidelity in the child welfare system. The following slides outline the decision units within the governor's recommended budget. Decision unit E 225 requests 1 additional quality assurance specialist and associated costs to support the Children's Mental Health Block Grant. Decision unit E 257 requests a contract for data collection and analysis used for various purposes related to program evaluation, quality assurance, and continuous quality improvement within the children's mental health. Decision unit E 259 requests authority for the federal Title IV-E prevention plan award. Decision unit E 260 and E 908 request transfer to clinical program planner positions and funding from the family support program, which is budget account 3146, to the Office of Analytics, which is budget account 3203. Decision unit E 499 and E 599 requests this request sunsets American Rescue Act funds, which eliminates 8 positions and preserves 3 positions. Moving on to budget account. Oh.
Madam Chair, would you like us to stop there and be available for questions, or?
Yeah, why don't we go ahead and take a break there? I think we have some questions coming up, and our first one, if we can go to Assemblymember Brown May.
Thank you, Chair. Thank you. for the information with regard to the decision units. I have a question with regard to the Family Support Program, ARPA-funded positions and eliminations that are proposed in this budget. It's my understanding that there are a number of positions that are being eliminated from this budget that were ARPA funded, but there are some positions that are filled. So can you discuss your plans for the agency with regard to the incumbents that are in those positions that are recommended to be eliminated by the governor due to that reduction? There's $2.9 million in ARPA funds that are being reduced out of that budget. Is that correct?
Thank you for the question, Marla McDade Williams. Prior to the budget being developed, we had active recruitments in place for many positions. And, with a lot of the efforts that were focused on recruiting, we were able to fill some of these positions while they crossed over through schedule for elimination. Our plan would be to follow the Division of Human Resources Management process for issuing layoff notices for filled positions if needed, but we would always do our best to fill those positions, put those people in those positions into existing open positions if they aren't continued forward.
Thank you. Follow-up, Chair.
Yes, go ahead.
Thank you. Are you able, how many employees, state employees are affected by that right now? How many positions that are currently filled with state employees, not contract positions, would be affected?
For the record, Marla McDade Williams, I believe it's 3.
Thank you for that. And then one more, Chair.
Of course.
It appears that there are 2 eliminated ARPA-funded positions that were continued through the FY25 base budget, and that IFC had previously approved those using the System of Care grant to replace that funding for those 2 ARPA positions, and then add 4 new positions. But those actions don't appear to be reflected in that 25-27 biennium budget. Do you have a plan for how that issue will be corrected going forward?
Thank you for the question, Marla McDade Williams. We're going to continue to work with your staff and the Governor's Finance Office to correct that. We did have an approved work program for them, so it is part of a technical process that we need to work through to get that all righted in the budget.
Thank you. And I think next we'll go to Assemblymember Mosca.
Thank you so much, and great to see you. My question was on the Federal Family First Prevention Services Act plan that you were going over. Could you please discuss the agency's plan to address the upfront funding that was not included but is needed in order to receive the federal Title IV-E prevention plan reimbursements?
Thank you for the question, Councilman Cannavaro, for the record. So we are actively working with the GFO partners to correct this. We did find that, according to the fund map, we do have the match. It's in a different category. We just need to make a adjustment so that we do have the match for that, so we can bring in those funds, the federal dollars.
And if I can ask you, I know that going through several of these budgets, we've had a little bit of advance notice that likely there will be probably amendments forthcoming on each one of these budgets. So if you don't mind, if there have been conversations during your presentation going forward, if you could just kind of maybe mention some of those and how if you begun working on those amendments, I think that would be helpful for the committee as well. And with that, do we have any other questions regarding this agenda item in this budget? Seeing none, I will have you go ahead and move on to the Southern Nevada Child and Adolescent Services budget ending in 3646.
Thank you, Madam Chair. Councilman Cannavaro, for the record. So 3646 is our Southern Nevada Child and Adolescent Services. This budget this unit, we provide assessments, care coordination, comprehensive continuum of mental and behavioral health services for severely emotionally disturbed children and adolescents from birth through 18 years of old. The following slides outline decision units within the governor's recommended budget. We have this budget, there is a possible budget amendment that we are working with GFO to address on this budget. So decision unit E253 request continues the youth-driven expenditures, including operating supplies and contracts. Decision Unit E607 this request eliminates one senior psychiatrist position with funding to be used for a contract position. Decision Unit E651 eliminates 20.51 full-time equivalent positions to support the cost of temporary contract staff for hard-to-fill FTE positions at Desert Willow Treatment Center. This decision unit also restores one clinical social work position to allow the agency to maintain the staffing to youth ratios. Decision Unit E900 request transfers 12 mental health counselor positions from the juvenile justice budget account 1383 to this budget account 3646. Decision Unit E902 transfers one psychiatric caseworker position from this budget account to youth parole services, which is budget account 3263. And then Decision Unit 903 transfers one psychiatric casework position and one clinical program manager position from this budget account to the Northern Nevada Child Adolescent Services, which is budget account 3281.
Thank you. I think we have some questions on this. I'll go ahead and start. Looking at some of these positions, I know that we've historically had a hard time filling some of these clinical positions. Can you describe some of the barriers that exist that prohibit the division from filling these 23 vacant positions that are recommended for elimination, or I guess I should say, it looks like 20 of them are being converted over to contract positions, but can you kind of discuss the problems that you've had filling those positions historically?
For the record, Marla McDade Williams, I think that it's primarily just not being able to compete with the private sector. There tends to be, especially, for the more clinical positions, it's a lot of competition out there, and we struggle finding people willing to come in. It's hard work in our facilities. Youth are very challenging, and so not everybody has to stay and deal with the challenges of that are there. We don't get any enhancements for dealing with more challenging youth. When we hire people to come in, but it's primarily just the competition with the private sector.
And I know previously we've obviously included these as FTEs and not contract positions, but how many of these positions right now are currently through contract workers? And I know you've been going through the work programs to do those in the past. Is this something that we've been doing for years and years and years?
Marla McDade Williams, I don't know if Ms. McCann-Navarro has the actual number, but I do know that one of the things that we have worked very closely with our clinical programs on is ensuring that we converted everybody we could that was serving as a contractor to a state FTE. We made a lot of progress doing that, but it still isn't enough to fill all of the positions with contractors. And then, we have to make a decision of, do we shut down wings, or, what do we do? Do we continue to provide care and eliminate the contract positions, or and keep the contract positions, or do we reduce care and eliminate positions? So it's just always a balance for us.
You don't anticipate that would there be any effect to the continuity and accountability of state services having these contracts, or are contract positions, or do you anticipate that the same people that are in those positions would continue on those positions, just formalizing that they're contract positions as opposed to state employees?
Thank you, Madam Chair. For the record, Marla McDade Williams. We do tend to get a lot of continuity and people staying when they're in contract positions. I'm not sure that I should say this today, but many of our clinical positions, they also provide services outside of state government. So the schedules that they have in place allow them to also supplement their income by providing services outside of their state-funded positions. And so this is a system that seems to work for them.
I'm sorry, do we have any safeguards in place to make sure that these contracted workers are held to the same performance standards, transparency, and accountability as full-time state employees? Obviously, you've indicated that some of them are working in other like jobs. Do we have a process of monitoring what types of other outside work they're doing and whether or not there's any potential conflicts with those separate positions that they are also holding outside in the private sector?
Marla McDade Williams, we do hold them to the same standards as the state FTEs in terms of how they provide care in our facilities. In some cases, because they're contract workers, if we need to make immediate changes with personnel, it's a little bit easier for us to do that with the contracted workers. We also require all contracted workers as well as state FTEs to submit secondary employment forms to us, and we verify that there are no conflicts based on those forms that we have coming forward.
Thank you. I think next I'll go to Senator Dondero Loop.
Thank you very much, Madam Chair. Can you talk a little bit about if the 2 psychiatric caseworker positions and the 1 clinical program manager position are transferred within that Southern Nevada Child and Adolescent Services budget? Is that not clear?
For the record, Marla McDade Williams, are you asking why we're proposing that transfer?
Yeah, what's the projected impact if that happens?
I will defer to Dr. Jacqueline Wade down in Southern Nevada to answer that question.
And Ms. Wade, if you can make sure you state your name for the record and spell it for our committee staff, that would be greatly appreciated. And go ahead and begin when you're ready.
Good morning, Madam Chair and committee members. Thank you for the question, Senator Dondero Loop. Dr. Jacqueline Wade for the record, Jacqueline, last name W-A.
You know what? We can barely hear you. If I can just ask you to kind of move closer to the microphone maybe and
Is that better?
Use your outside voice as best you can. Thank you so much.
Is that better? Can you hear me now?
That is much better. That is much better. Thank you so much.
Okay, the reasoning for the transfer of the position is we are seeing an increase in our cases in the north, and we do have adequate capacity in the south, and so that is the rationale so that our families can access services a lot sooner, and they can get into care a lot faster than if they're on a wait list. So that is the rationale for moving the 1 position to the north.
So you answered my Northern Nevada question, but what about the Southern Nevada Child and Adolescent Services budget account if those 2 psychiatric caseworker positions and the clinical program manager position are transferred?
With the clinical program manager position to the north, that would allow for workload to be decreased from the clinical program manager 2, allowing for monitoring of assessments and youth coming from out of state and making sure that the transitions back to Nevada are done seamlessly, so there'll be no impact in the South.
Okay, thank you. I don't know if I'm hearing it wrong, so forgive me for asking this, but you've answered about the north. Is the Southern Nevada Child and Adolescent Services being affected as well? Did you say that and I just didn't hear it?
Madam Chair, if I can, I think Marla McDade Williams, if I understand correctly, I believe that these positions are related to our wraparound services, and we, as you may know, issued a contract to a provider to build wraparound services in Southern Nevada. That was our target area for Southern Nevada. So the need for wraparound services in Southern Nevada decreased because we had resources focused on that. The need increased in Northern Nevada because we haven't focused there yet. So these positions are related to that.
So I appreciate that answer. Do you then switch people because you don't have people that just move back and forth between the north and south, do you?
For the record, Marla McDade Williams, we don't switch people. We generally work with people when we have vacancies and we choose to fill in the area that we need the positions filled in, we wouldn't require someone necessarily to move to Northern Nevada from Southern Nevada if they were in a filled position. We take that opportunity when we have vacancies to fill them in the region where the need is.
You know, it just seems like it would be difficult because if I'm working in the South and then all of a sudden you don't need my services and you're like, oh, well, pack your bag, we're going north. I mean, we might do that as legislators, but I can't imagine doing that as like a real job that's paying my bills. And now I've got 2 houses or a house and an apartment or something.
For the record, Marla McDade Williams, we would not do that. Like I said, we take opportunities. Unfortunately, we have a lot of opportunity with vacancies to be flexible in where we choose to fill them. Sometimes we're doing statewide recruitments for positions outside of this, but and just taking applicants where you can find them because you can pay for some travel or do whatever. But when we're moving a duty location, we try to ensure that we are doing it in vacant positions and filling them in the location where we have the need.
Okay. Madam Chair, may I ask one more question, please?
Of course, go ahead.
So with those transfers in mind, can you discuss the recommended transfers in response to the short-term increase in cases? Or is this a recommended change? Is this like a long-term strategy or is this a short-term strategy?
Dr. Wade.
Thank you for the question, Madam Chair, through you to Senator Dondero Loop.
Feel free to go
The
directly
hope
to the
is-
member, but please state your name again.
Oh, Dr. Jacqueline Wade for the record. The hope is to have the position be permanent, since we do have a footprint of that care management company in the South, and we do not have it in the North as yet. So it will increase capacity and serve more families.
Thank you, Madam Chair.
I just have a follow-up on this. So we're transferring this position from the south to the north because there's obviously, it sounds like there's obviously a need for the position up there because it sounds like there's an increased caseload in the north. I have a hard time believing that the southern, Nevada, has had a decrease in caseload. So would you just need to add another position, or has the caseload actually decreased in southern Nevada that allows for the transfer to this northern position?
Dr. Jacqueline Wade for the record, the numbers have decreased in the South, and at this time, the South is supporting the North.
Okay, thank you for that. It's kind of surprising. I think Senator Stone has a question next.
Thank you. Just to follow up, Madam Chair. So you've seen a decrease in caseloads in the South. You've seen an increase in caseloads in the North. You don't transfer the personnel from the South to the North. So what are you going to do with the 3 employees that are in the South? Are you going to reassign them someplace else? Because we're talking about a budget. So are we going to have double costs here, or how are we going to amortize the cost?
For the record, Marla McDade Williams, they will not be duplicated positions. We only have authority to fill the positions that we have authority to fill. I believe there was an oversight in the transfer of these positions, a technical process where when you change a duty location, you follow a process to change a duty location. In this case, I think we may not have followed that process, and we just need to ensure that we go back and do that. But we would not require the employees to move back to Southern Nevada. If we didn't get authority to do that again, we would be looking at other vacant positions to have them fill in the geographic location that they were located in.
Do we have any other questions? Just kind of looking around here. Okay. If we can go ahead and we'll close that, the hearing on that budget and move on to the Children, Youth, and Family Administration budget, ending in 3145. Go ahead and begin when you're ready.
Thank you, Madam Chair. Councilman Navarro for the record. Budget account 3145 is our Children and Youth and Family Administration budget. This budget DCFS is responsible for child protective and welfare service delivery in the 15 rural Nevada counties and provides oversight of urban county-operated child protective and welfare services, children's mental health and behavioral health treatment, and residential services, statewide juvenile justice services, including the youth correctional centers, youth parole, and the victims services unit to Nevada's crime victims. So this is our admin budget. We are currently working with GFO on a budget amendment for this budget account as well. And then the following slides outline the decision units in the governor's recommended budget. Decision Unit E225, this adds 2 additional management analyst positions for the DCFS contract unit. Decision Unit E228 adds 1 personnel analyst position to support the division's human resources unit. Decision Unit E499 and E599 sunsets the American Rescue Act funds, which eliminates 8 positions and restores 7 positions. And then this decision unit also requests to eliminate the community recovery grant projects that are ARPA funded.
Thank you for that. Assembly Member Monroe Moreno.
Thank you, Chair. The quality assurance specialist it was funded by ARPA funding positions. But it looks like it was continued in the agency's base budget, but that position, if I'm correct, should have been eliminated in FY25. Could you let us know what the steps you're taking to correct the agency's base budget and the governor's recommendations for that position?
Yes, absolutely. Kelsey McCannavar for the record. That position is, we're currently working with GFO on a budget amendment to remove that PCN from our base budget. It was an oversight.
Thank you. And do you have an estimated timeframe of when we'll receive that amendment?
I know that I had a conversation with GFO yesterday, and we are working through it.
Thank you so much. Thank you, Madam Chair.
Of course. I believe Assembly Member Brown May has a follow-up.
Thank you, Chair. Thank you. I have a question. It looks like there's a recommended reduction from our one-time ARPA funds totaling $4.6 million that went to programs. And I'm just curious to know, they were one-time ARPA funds. Did the programs know that it was one-time and there's no follow-along, no surprises? And as an example, the APRN Advanced Degree Program has 368 nurses enrolled or participating. It's a nationally accredited program, but I just want to make sure that they are aware that there's no continuation of the funding, and that's not the expectation.
Thank you, Madam Chair. Marla McDade Williams, for the record. They are aware that it's time limited. We're very clear about that when we issue those funds.
Thank you. Any further questions? Seeing none, we will move on to the next budget item, which is the Victims of Crime, 4895. Go ahead and begin when you're ready.
Thank you, Madam Chair. Kelsey McCannavar for the record. The Victims of Crime program provides financial assistance to eligible persons who are victims of violent crimes committed in Nevada. This program pays hospital bills, medical and dental treatment costs, mental health counseling costs, lost wages, funeral costs, and other crime-related expenses. The following slides outline decision units within the governor's recommended budget. Decision unit E253 adds general fund appropriations to replace American Rescue Act funds to maintain the program. Decision Unit E304 adds 3 crime victim compensation specialists and an online payment and application system to review and process compensation claims for victims of crime. And then Decision Unit E499 sunsets the American American Rescue Act funds for various projects.
Thank you. Assembly Member Yeager.
Thank you so much, Madam Chair. Thank you for presenting this. I do remember last session the governor's proposed budget had zeroed out this account, and so I was happy that we were able to restore this. I have a couple of questions. I found it a little bit interesting and maybe a little bit troubling that the group we're contracting with is called cost containment strategies. Cost containment strategies, in my mind, doesn't really jive with compensating victims of crime, so it's an interesting name, and I just want to put on the record that, containing costs is is not a statement of our values when it comes to victims of crime. And so I know you can't control the name of that, but I just wondered, do you know when that entity communicates with victims of crime, do they see that name? Like, does the communications come from cost containment strategies, or do they send it like on behalf of the state of Nevada? Because I really would be worried that they're getting communications that say in the very title, we're trying to contain costs when we're also trying to make you whole as a victim of crime.
For the record, Marla McDade Williams. I'll have to actually verify what the checks come as. I do know that we manage the upfront portion and authorize what they actually get paid out. So they don't control that. We control what actually gets paid out in accordance with state and federal law. But I'll verify what the actual checks look like. Thank you.
Yeah, thank you, and you know, I understand that. I just want to make sure we're not sending the wrong message to victims of crime that somehow our priority is containing costs. Obviously, we have to be mindful of budgets, but I want to just make sure that, you know, maybe if that is the case, if we're going to continue to use that entity, perhaps they cannot have the name of their firm on the communications with the victims. And so, thanks, I appreciate that. A couple other questions, and one sort of relates to this. I know you're trying to potentially transition away from that vendor, but there's some issues in doing that because apparently they're the only one who can really provide you the data that you need. But if you are able to move away from that vendor, how are you going to ensure that there's not a delay in processing claims for victims of crime?
For the record, Marla McDade Williams. I mean, it's like any contract that we have, there's a transition period, and we will ensure that we don't cut someone off prior to ensuring that we are able to make the payments as we're required to make them.
And then, Chair, if I could ask one last question.
Go ahead.
Thank you. And so the question that relates to the federal funding question, which is something we've talked about with a lot of different agencies. Obviously, this account is pretty unique in that regard, but can you talk about whether you expect federal funding supporting the victims of crime compensation, if you expect that to decrease further in future biennia, and if so, how it would impact the compensation claims that you're able to process?
For the record, Marla McDade Williams. I think this is one of the federal programs where the state's spend gets us the federal spend. And so the goal is always to ensure that we spend appropriately on the front end from the state side so that we continue to get the federal match that would ensure that we are able to continue to compensate victims.
And Chair, not a question, but just a statement if I could. And I just want to ask you, I've asked other agencies too, we're obviously trying to monitor what's happening with the federal government. I think there's a lot of confusion there, but if you do get indication that this particular federal funding, I know it's a match, but if you get indication that that might change in some way to the detriment of Nevada and to the detriment of our victims of crime, if you could just keep us and our fiscal staff in the loop on that. Obviously, compensating victims of crime is a sacred mission that we take seriously, so we want to make sure that there's enough money here to do that. So please just keep in communication and don't assume that we know, because maybe we don't. It seems like the information changes hour to hour and day to day. So if you could commit to doing that, I would really appreciate it. Thank you, Chair.
No. Assemblymember Monroe Moreno, please.
Thank you, Madam Chair. By looking through the backup information, there was in the governor's recommended budget money allocated for 330 square feet of space for those 3 new positions that you're asking for to be at the Decatur location. However, I believe that you've moved to the new complex down in southern Nevada. So would the money still be needed for that Decatur expansion? If you're not there, have you moved to the new location? And will we be getting a budget amendment to remove that dollar amount?
Thank you for the question, Councilman Canavar. For the record, that the Victims of Crime unit has moved to the new Warm Springs location, the Mineral Building, and so we will not need the rent for the Decatur. However, we will work with our GFO to determine if, I'll have to look at the spreadsheet to see if we already included that in our rent calculations for mineral. We can
Thank you
follow up
so
after
much.
the.
Thank you, Madam Chair.
I have a question kind of about moving away from this cost containment strategies, which I agree is a interesting name to be running a victims of crime program. But seeing how the problems that we've had filling different various IT positions, seeing the problems that we've had when we administer payment systems and when we are administering a lot of these technical programs throughout, like not just DHHS, but all like state agencies. What concerns, or do you have a program in mind, or do you have people that are already in place to set up this alternative program that so we can move away from this third-party vendor?
For the record, Marla McDade Williams, we will have to go out to an RFP, and the intent with that RFP is to secure a product that doesn't require a lot of programming, that it's almost that it's just easy to manage. The compensation specialists that we are looking to bring in this process will really be processing payments and ensuring that those payments are consistent with what our obligations are to pay out. But the expectation is that they're not doing programming and they're not having to do a lot of those types of things to be able to manage the software program that we are able to bring online. I don't know how successful that RFP will be. We all we can do is go out and see whether or not there are vendors out there who are able to do this. If we have to bring it in-house in terms of building our own system, then yeah, we probably will be coming back and asking for a different resource to be able to do that. But we haven't had the opportunity to really make any of those decisions at this time.
I guess I'm confused then. Can you again confirm what's necessitating this change from this third-party vendor to this unknown?
For the record, Marla McDade Williams. We are being asked to by the state purchasing rules. We need to go out and we need to see if there is somebody else out there because they've been a sole source for a very long time. But the other part of it is we are unable to access some of the key data points in the behind the scenes of what we're paying out. And when we are looking at a new product, we are intending that, like we do for all of our other programs, we're able to access back-end information through the Office of Analytics to be able to do analysis. We are unable to do that with this vendor right now. It's a system that started with the federal government and just has not developed in a way that allows us to really manage the information that goes into it. It really manages payments. We say, here's the payment, and so we have some front-end data, but we don't have any back-end data where we could really do good analysis. And that's really one of our goals, is to ensure that we have that access to that information.
Thank you. Any further questions here from the committee? I guess with that, we will close the hearing on that victims of crime budget and move on to the information services budget at 3143.
Thank you, Madam Chair. Councilman Cannavaro, for the record. Budget account 3143, Information Services. This is the unit that DCFS supports the technology needs of the state and county agencies for child welfare. We are in talks with GFO regarding a possible budget amendment for this budget account. Excuse me. The following slides outline decision units within the governor's recommended budget. Decision unit E710 replaces computer hardware and associated software. Decision unit E905 transfers costs associated with the My Avatar system from Southern Nevada Child and Adolescent Services budget account 3646 to this budget account 3143.
Thank you for that. And if we can move to Assemblymember Brown May.
Thank you. Thank you, Chair. Thank you. Okay. So this Unity system, right, is we're federally required to have this. This is the system that talks federally. Am I correct? I see the nod, so that's a good start. Okay. So it appears as though there are 27 positions that currently support this Unity system. How many positions do you anticipate are going to be needed to maintain the system as we're working on this replacement project? Right, we have to have this, right? And we're making changes, but it doesn't look, in my documentation, it doesn't look like we're adequately supporting the transition. Can you talk about that?
For the record, Marla McDade Williams. So right now, this is a very programmer-intensive system. We've done a needs assessment with a contractor. We will be going out to RFP sometime this year. The intent is that we're getting a system, again, that is more off the shelf, that just requires caseworkers to enter information as opposed to us doing programming. So the positions that currently are doing programming will eventually no longer be needed. And then we'll be in the situation that we are with other positions of needing to follow the process from the Division of Human Resources Management for layoffs. We have had, this is one of our areas where I believe when I came in, we had something like 40% vacancy rate. We're down to 11%. There does continue to be turnover in that unit. So, I believe that there are probably opportunities for those individuals with that technical skill to either be absorbed into our other IT functions or in other IT functions throughout the state of Nevada.
Thank you. Follow-up, Chair.
Of course, go ahead.
Thank you. Okay, so it looks like, I have a lot of questions. It looks like
Speaking of.
we're on track, potentially, but there's not a lot to, like, we've not gone to the we're in the RFP development process right now, but we have not gone to RFP. And it looks like ARPA funding was approved during IFC in 2022, right, with a projected total cost would be $31.1 million there. If the project is not anticipated to be completed until October of 2027, do we have any idea what the total projected future expenditure for this product is going to be? And then I will also follow up and say that it's pretty unclear about when are we going to expend the money? So could you provide an update on the total projected cost to replace the Unity system?
For the record, Marla McDade Williams, I will have to get back with you to see if we have any projected costs. What I know at this point is that in the needs assessment, we identified a whole lot of a wish list, right, of things that we wanted. And in the end, depending on the amount of money that we have to move forward, the product can only support, will have to support basic needs, and we may not be able to get all the bells and whistles that we want, depending on the budget that we have at that time. But I will have to get back to you on any specific projected costs that we have.
Thank you. One more, Chair, if you don't mind.
Go ahead.
Thank you. So, okay, so just to wrap this a little bit, help me understand, right? It's a federally required system, Title IV-E reimbursements, right? And we get federal dollars to match. Is there a plan? Can you talk about how your agency and the GFO plan to provide the state funds to help realize our federal Title IV-E reimbursements? Is there a recommendation, or is this another anticipated budget amendment?
For the record, Marla McDade Williams, my understanding is that we will be proposing a budget for this in the next biennium. It is, as you said, our ongoing requirement for accessing federal 4E funds is to have this system in place. And we're going to be in development over the next 2 years, right, for it. And then we would, once we have a product and know what the costs are, we would come back in the next biennium with a budget for it. Right now, it's matched by general fund dollars, in terms of the system itself and costs for it. This new project that we're developing is matched with ARPA dollars. And so, but moving forward, it will be part of our operation, just like it's part of our operation today.
Do we have any other questions from committee members? Seeing none, thank you on that. So if we can close that one and move on to the Child Welfare Trust bill, our budget ending in 3242. Go ahead and begin when you're ready.
Thank you, Madam Chair. Councilman Navarro, for the record. Budget account 3242, Child Welfare Trust account was established to receive benefits for survivors or other awards payable to children receiving child welfare services in a county whose population is less than 100,000. These benefits or other awards, including Social Security and supplemental income, are deposited and credited to this fund. So the following slides outline the decision units within the governor's recommended budget. Decision Unit E260 eliminates the state's deduction for the cost of care in this account, contingent upon passage and approval of the enabling legislation. Sorry, Councilman Navarro, for the record. This is we are working with GFO on a budget amendment for this budget account as well.
Thank you. It's a theme for the morning. If we can go to Senator Cannizzaro.
Thank you, Madam Chair. So first, I guess, I know you mentioned there was going to be a budget amendment, but for this particular item, can you confirm, because I think as we understand it, can you confirm that this recommendation would reduce the transfers to the rural child welfare budget by that $97,000 in each year of the biennium, instead of providing the general fund appropriations in each year of the biennium?
Councilman Navarro, for the record, yes, that is correct.
And then I guess my other question is with respect to the budget amendment piece. Do you know what if anything that's going to change in this, or what that looks like, or you're still working on it?
Councilman Navarro, for the record, we're still working on it. We will be removing general fund. General fund was added. It was a technical error, and it'll be adjusted.
Okay, so this shouldn't change then that, and it should then comport with the question I asked about this wouldn't result in that general fund being used.
Yes, Councilman Navarro, for the record.
Okay, thank you. Thank you, Madam Chair.
I have a couple of questions regarding this. Is this something that you currently do with these funds for these children?
For the record, Marla McDade Williams. So the statute requires us to use these funds for child welfare support. So the budget bill draft request that is coming forward will repeal that requirement in statute.
Okay, that's why I wanted to make sure. And would the proposed, I guess, implementation of that, would it require all of the counties to do this as well, or just on the state funds?
For the record, Marla McDade Williams, it's just the state funds.
And is
It's
there
just the rural child welfare budget.
That's what I was curious about. Have you worked with any other agencies and how you are going to set up these potential trusts? And do you anticipate any additional costs in maintaining these trusts in place to distribute these funds when these children turn 18?
Thank you, Madam Chair, for the question. Councilman Navarro, for the record. We already are creating a separate account for each child that's coming into care if they have this funding. So there would be no difference in what we're currently doing. It would just not transfer to the rural region budget.
Did you have any difficulty in maintaining these accounts? I know that especially with Social Security payments, you can't carry like a balance that's too high. So are you setting up certain types of ABLE trust accounts, or how is that working so you comply with the federal government, or are they partially being spent down in order to stay under that? I believe it was around 2,000, or it's probably increased by now.
Councilman Navarro, for the record, I'm not sure. We can follow up on what the exact dollar amount is, but we are working with the youth and trying to spend that funding down so that they have access to their money before sending it back to Social Security.
Wonderful, thank you. Any further questions? Seeing none, we will close that hearing and we will move on to Northern Nevada Child and Adolescent Services, budget account 3281. Go ahead and begin when you're ready.
Thank you, Madam Chair. Kelsey McCann Navarro for the record. Budget account 3281, Northern Nevada Child and Adolescent Services provides assessment, care coordination, and comprehensive continuum of mental and behavioral health care services for severely emotionally disturbed children and adolescents from birth to 18 years of age. The following slides outlines decision units within the governor's recommended budget. Decision unit E605 eliminates 3 positions that have been vacant over 2 years and is offset by 1 temporary contracted psychiatric nurse position due to the position being hard to fill. And then decision unit E903 transfers 1 psychiatric caseworker position and 1 clinical program manager position from this budget account to Southern Nevada Child and Adolescent Services, budget account 3646.
Thank you. And I believe we have one question or a couple questions from Assemblymember Howdigy.
Thank you so much, Madam Chair. I just have a question regarding the 2 positions that were requested to be eliminated. It's the clinical social worker position and the psychiatric nurse position. I know that they've been recommended to be eliminated, but since that recommendations, you've filled the positions. And so have you guys had discussions with GFO about possibly changing or submitting an amendment to keep those positions instead of recommending elimination?
Kelsey McCann Navarro for the record. Yes, we've had those conversations. We are actively working with GFO to see if we can continue to fund those positions.
Okay, thank you. And then I had one other question, Madam Chair, if I could have a follow-up.
Go ahead.
Okay. It was regarding the mental health counselor position. I know that that's the 3rd position that's being recommended for elimination, and it's going to be recommended that you get a contract position to do that instead. But can you walk us through how have you been providing this outpatient treatment if you haven't had this position filled in more than 2 years?
I'll defer, Marla McDade Williams, I'll defer that question to Dr. Wade.
Thank you for the question. Dr. Jacqueline Wade for the record. What happens when we are having difficulty filling those positions? Our current licensed personnel, they end up having to increase their capacity and see the families.
Thank you. So just to confirm, what I'm hearing is you currently have mental health counselor positions filled and they've just picked up the caseload. So is that correct?
That is correct, Dr. Jacqueline Wade for the record, correct.
Okay, thank you. Thank you, Madam Chair.
Thank you. Last chance, everyone. I like it. Either people are not awake or we have been very efficient with our time. I'm going to go with a second. Thank you for your presentations today. And I think this closes our final budget hearing. And we will move to our last item on the agenda, public comment. If you have public comment, please make your way up to the table, both in Las Vegas and in Carson City. And I will give the number if you are calling online. The number is 1-888-475-4499. The meeting ID is 889-8261-6274. Again, I will remind everyone to try to limit your public comment to 2 minutes. Please clearly state your name and spell it for our committee staff, and begin when you're ready. We'll start here in Carson City.
Hi, my name is Sabrina Schnur, SabrinaSchnur, and I am here on behalf of Foster Kinship, Nevada's only nonprofit exclusively serving kinship families. We are proud to partner with the state of Nevada's DCFS to support kinship caregivers and ensure children remain safely with the family. Nevada has an opportunity to draw down Title IV funding for the state's evidence-based kinship navigator model, which is already being implemented in Utah, Minnesota, South Carolina, Alabama, and soon Pennsylvania and New York. These states are maximizing federal dollars to expand support for kinship families. Nevada should do the same. By leveraging Title IV, we can strengthen services, improve child welfare outcomes, and provide sustainable, cost-effective support to kinship families across the state. We look forward to continuing our partnership with the state to make this a reality. Thank you.
Thank you. Anyone in Las Vegas? I don't see anyone down in Las Vegas. I don't see anyone further here in Carson. Can we go to our phone lines? Do we have any callers?
Thank you, Chair. The public lines are open and working. However, there are no callers to provide public comment at this time.
Thank you, and thank you, everyone. And hopefully we gave you back about an hour of your day. I'm sure you will use it to good use. And at this time, we will adjourn the Joint Subcommittee on Human Services, and thank you.